The human ovary, the physiologic responsibility, what is the physiological responsibility of the ovary is the periodic release of the gametes, eggs and oocytes, and the production of steroid hormones, estradiol and progesterones. Okay, both activities are integrated with the continuous repetitive process of follicle maturation, ovulation, and carpacillary formation and reaction. The ovary therefore cannot be viewed as a relatively static organ nucleus, whose size and functions expand and contract depending on the vigor stimulating traffic hormones. Rather, the female gonad is a heterogeneous ever-changing tissue who has cyclicity measured in weeks rather than hours. The ovaries consist three major portions, that is outer one is the cortex, and the central is the medulla, and the rete ovary, the hilum. The hilum is the point of attachment of the ovary, point of attachment of the ovary to the mesoovarium. It contains the nerves and blood vessels and the hilar cells, which have the potential to become active in steroidogenesis to form the tumors or to form tumor. These cells are very similar to the testosterone producing cylinder cells of the testes. The outermost of the cortex is called tunic albuginea, and the topped on the surface by a single layer of cuboidal epithelium reproduces ovarian surface epithelium or the ovarian mesothelium. Epithelial ovarian carcinomas account 90% of human ovarian cancers. The oocytes enclose in a complex called follicles in the inner part of the cortex, embedded in the stromal tissue. The stromal tissue is composed of connective tissue and interstitial cells, which are derived from the mesenchymal cells, have the ability to respond to the luteinase, LH, and HCG with the androgen production. The central medullary area of the ovary is derived largely from the mesonephric cells. Okay, the fetal ovary during the fetal life, the development of the human ovary can be traced through four stages: the indifferentiated gonal stage, the stage of differentiation. Initially, it is indifferent, then stage of differentiation, the period of oogonia multiplications, and the oocyte formations. Finally, the stage of follicle formations. Okay, there is stage four stages. Okay, for the fetal ovary, the development of the fetal ovary, there is four stages: indifference, differentiations. Stage of first is the indifference gonadal stage. The stage of differentiation, then period of gonadal multiplications, the oocyte formation, the stage of follicle formations. Okay, then indifferent first stage is the indifferent gonads, and approximately 5 weeks of gestational age, the pair gonads structurally consolidated coelomic prominence over like the vesicaprus. Okay, the fetal ovary. During fetal life, the development of the human ovary can be treated through four stages: indifferentiated gonad stage, the stage of differentiations, the period of oogonal multiplications and oocyte formations, the stage of follicle formations. Okay, there is four stages: indifferent gonad, the differentiation, then period of oogonal multiplications, then oocyte formations, finally the stage of follicular formations. First, in the stage of indifferent, approximately 5 weeks of gestational age, there is a pair gonads are structurally consolidated. Coelomic prominence overlying the mesonephros, forming the gonadal reeds. The gonadal reeds is formed from the coelomic prominence that overlying the mesonephros. At this point, the gonad is morphologically distinct as primordial testis or ovary. The gonad is composed of primitive germ cell intermingled with coelomic surface epithelial cells and inner core of medullary mesenchymal tissue. Just below this ridge, there is lies the mesonephric tract. This indifferent stage lasts about 7 to 8 days. Just together, the mesonephros and the genital reeds, called as the urogenital reeds, indicate the close association of the urinary and reproductive system. So, for the 5x, approximately when the 5x of gestation, there is a pair gonads are structurally concentrated in the coelomic prominence overlying the mesonephros, forming the gonad reeds. At this point, there is a gonad is morphically indistinguishable as primary testis or ovary. We can distinguish. So the gonad is composed is primitive germ cells with intermingled with coelomic surface epithelial cells and inner core of medullary mesenchymal tissue. Just below this, there is a mesonephric tract. This stage will last for 7 to 10 days. Together, the mesonephros and the genital reeds called urogenital reeds. Okay. This indicates the association of urinary reflection. The original origin of the gonadal somatic cell still not certain. The earliest recognizable gonad contains the besides germ cells, it contains somatic cells derived from the at least three different tissue. Like it is derived from the coelomic, epithelium, mesenchymal, mesonephric tissue. Okay. Apart from germ cell, it contains somatic cell. A somatic cell can be derived from three different tissue. It can be coelomic, it can be mesenchymal, it can be mesonephric tissue in the one element. Okay. The contribution of the mesonephric cells require for the migration into the gonad. This movement is regulated by fibroblast growth factor 9 in the male, and it may be replaced by gene encoding SPR2. Okay. Then the contribution of the mesonephric cell. Why this mesonephric cell require? The contribution of the mesenteric cell requires migration into the gonads. This movement, the migration of the mesenteric cell into the gonad, this movement is regulated by the fibroblast growth factor 9, FGF9, in the male, and it may be repressed by a gene encoding a protein known as SPRY2. Thus, Y chromosome directs sexual development by influencing the gene expression by a specific regulating and signaling protein. So, Y chromosome is very, very important. If Y chromosome absent, the gonad will be it is a default sex, like it is always a female sex. Okay, so that will develop a female gonads. So, if Y chromosome is there, that will replace this FGF9, so that migration will not happen, and by the help of SPRI2 proteins. Okay, the primordial germ cells originate within the primitive ectoderm. The primordial germ cells originate within the primitive ectoderm, but the specific cells of origin cannot be distinguished. The germ cells are first identified at the end of the third week of after fertilization in the primitive endoderm, at the caudal end in the dorsal wall of the adjacent yolk sac. So the germ cells are first identified at the end of the third week after fertilization. Okay, end of the third week. Germ cells, primitive germ cells, the first identifiers in the at the end of the third week of after fertilization, the primitive endoderm at the caudal end of the dorsal wall of the adjacent yolk sac. So also there's appear splanchnic mesoderm finding appear. Gonadal ridge is the only one side where the germ cell can survive by displacement, because growth of the embryo also active. Okay. Then male and female differentiations of the gonads directed by the sex chromosome, but the decision to be male or female must be communicated to the cells in the different gonad. This communication is genetic in origin, involve the signaling proteins of the receptors programmed by the fundamental impact that depend on whether Y chromosome is present or absent. Okay. Then the stage of differentiation is the indifference gonad. If the indifferent gonad is destined to become a testis, the differentiation along this line will be take place at 6 to 9 of gestational weeks. The absence of testicular evolution, formation of medullary, absence of testicular evolution like formation of primary medullary sex cord, primitive tubules, incorporation of germ cells, gives implicit evidence of the existence of primitive cation ovary. In the testis, the factor that determines whether the indifferent gonad will become a testis is called as testis determining factors. Test TDF, that is a product of single gene located in the chromosome Y chromosome. The testicular determining factor is gene located in the region of the named SRI gene. Sex determining region of the Y chromosome. The protein product of the SRI gene is contain a DNA binding domain to activate the gene transcription that divert the development of the gonadal stomatic cells from the pathway of follicle cells to short leaf cells. Rare the cases have been reported phenotype infertile males with 46 XS cat where the male differentiation into translocation of Y chromosome fragment containing SRI to an autosome or an X chromosome. The normal testis development requires not only the presence of SRI gene, but normal development requires not only the presence of SRI gene, but its interaction with the autosomal gene also. So not only the SRI gene, but it has to interact with the autosomal gene so that development will be proper. Gene similar SRI been named as SOX gene, that is similar with the SRI box gene that contains the DNA binding sequence. SRI expression precedes the SOX expression. Indeed, SRI acting cooperatively with steroidogenic factor, it should act by combined effect of other. It should combine cooperatively acting with the help of steroidogenic factor 1, FGF9, fibroblast growth factor 9, and a member of the fibroblast growth factor familiarity that upregulate SOX9 gene expressions. Okay. Thus, SRI along with partner protein target specific. The FGF9 fibroblast growth factor 9 to replace the gene that induce ovarian development, such as it for ovarian development there is two genes, that is WNT4, a member of the English family of gene, responding 1, TAX1 doses sensitive sex reversals, adrenal hyperplasia critical lesions on chromosome X gene 1. Okay, POXL2 also. All these are the required for the development of the ovary. For the development of ovary there is 4. One is WNT4, responding 1, TAX1 and the POXL2. Okay, both testis and ovary differentiation require dominantly acting genes with the SRI inducing testing development by upregulation of the SOX9, with other genes primarily WNT4 responding 1 trimming to promote ovarian development by repressions. So for the ovarian development there should be suppression of the SOX9 gene and activation of the WNT responding 1. The concept view the fact that the biopotential gonad is balanced between the opposing forces on the SRI as the key factor. In XY gonad, SRI gene induce SOX9 tips differentiation to a testosterone. In excess gonad, lacking of XRY. So in a female sex chromosome, that lacking of XRY genes, so other genes combine to replace the succinate from the ovarian development. The expression of the SRY gene confined to the genital trees during fetal life, but the gene also active in the germ cells of the adult, perhaps playing a role in the spermatogenesis also. So SRY gene also role in the spermatogenesis in the adult. It usually present in the genital trees in the fetal life. Okay. The ovarian development requires the action of the genes such as W24 and respond in one DAX1, which stims replace the gene expression of the succinate and other genes that promote the ovarian development. Replace the expression gene in the testis pathway and other genes that promote ovarian development. When the Y chromosome containing SRY is present, the gonad development is the male phenotype is different than the product of anti-polarity hormone and testosterone. So the gonad is different than the phenotypical character. The secondary sexual character, external and internal genital will different. Okay. So here the Y chromosome containing SRY is gene present. That will the gonad will develop in testis, but the phenotype, it is a male phenotype or a female phenotype, depend on the product like fetal testis like anti-polarity hormones and the testosterone. Okay, whereas the female phenotype is the result of the absence of this fetal gonadal product, anti-Mullerian hormone, which inhibit the formation of the Mullerian duct. So, the name is suggests it is a Mullerian hormone, anti-Mullerian, inhibit the Mullerian duct formations. Is secret at the time of Sertoli cell differentiations, begins at the 7 weeks of gestational age. AMH expression alter the mutation in the AMH gene. It usually occurs in the 19 chromosome. Okay, then AMH AMH production is little life in the granular cells, leads to autocrine paracrine. Okay, the testis begins at differentiation for 6 to 7 week gestation with the appearance of Sertoli cells that aggregate to form testicular cords. The primordial germ cells are embedded in the testicular cord that will form the Sertoli cells. The primordial germ cells are embedded in the testicular cord that too will form the Sertoli cells as formed gonia. The mature Sertoli cells are the site of production of the androgen binding proteins, important maintaining the high local androgen environment necessary for the spermatogenesis and inhibiting. Okay, the Leydig cell beginning differences are the 8 weeks of mesenchymal cells of the interstitial component of the surrounding the testicular cord. The secretion of the AMH species steroidogenesis, the Leydig cells. Shortly after the appearance of the Leydig cells, the secretion of testosterone begin. The androgen secretion increase in conjunction with the increasing Leydig cell number until a peak reaches 15 to 18 weeks. The Leydig cell regression begins at the birth. Only a few Leydig cells present at the birth. The cycle of fetal Leydig cells follow rise in decline in fetal SCC level, peaking at 10 weeks, decline at the 20 weeks. Okay. Testosterone synthesis in human fetal begin at the 8th week gestational age, it peak in 15 to 18 weeks. The testicular function of the fetus correlate the fetal hormone pattern, although initial testosterone productions and sexual differences are response to the fetal level of SCTS. The initial testosterone production it depends on the fetal SCTS and the beta fetal SCG. Further testosterone productions and masculine differences are maintained by the pituitary gonadotropes. The decrease in the testosterone level in the late gestation probably with the decrease in the gonadal level. The fetal Leydig cells by unknown mechanism avoid downward locations. Okay, the fetal spermatogonia derived from the primordial germ cells are in the testicular cord surrounded by the Sertoli cells. In contrast to the female, male germ cells don't share mitotic division before the. Remember, this male primitive germ cells don't start mitotic division before the puberty. Okay, this is gonad, this is mesonephric dog, this is your gonads. This is a paramesonephric or Mullerian dog, this is a mesonephric or undifferentiated stage mesonephric dog. Okay, this is the fallopian tube. This is a fallopian tube one here. This is a fallopian tube, uterus, ovary, mesonephric remnants, vagina, appendix, testis, seminal vesicles, vas deferens, epididymis. Okay. The difference in the Olympian system begins with the increase in the testicular testosterone production. So the starting of the Olympian system begins with the increase in testicular testosterone productions. The male internal genital true not all androgen sensitivities would occur prior to testosterone in the presence of masculine differentiation, but the development of the seed structure like seminal vesicle, the development of the seed structure, I already told you the Olympian duct structure, the seed structure only recur at the different at the testosterone level only, that is seed structure like seminal vesicle, epididymis, vas deferens, they only depend on the testosterone. But remember, for the development of the urogenital sinus and the urogenital tubercle into the male external genitalia, urethra. For the development of the Olympian duct structures like seed structure, SEED, seminal vesicle, epididymis, and vas deferens, they differ in the testosterone. As an intestinal mediator, whereas the development of the urogenital sinus, urogenital tubercle, urogenital sinus, and the urogenital tubercle into the male external genitalia, urethra, prostate require the conversion of the testosterone. They require dihydrotestosterone. So, in the female, the loss of Olympian system due to lack of the because the Olympian system is absent becoming female due to the lack of the production of the testosterone. Okay. Then this is the first stage, the stage of differentiation over. Then third stage is the stage of oogonial multiplication, oocyte formation in the ovary. Just as testicle development requires SRY and SOX9 expression, specific molecular signaling pathway are necessary for the ovarian differentiation also. Oocyte survival also. In the developing ovary, the most important gene is W24 and the respondin 1 already both activate the beta catenin signaling pathway in somatic cells. Okay, the W24 and the respondin 1 cooperate to suppress the somatic cell expression, SOX9 expressions. Okay, thus ovarian differences depend on the essential genetic molecular signaling that is activity aspects of the SRY gene. Such is the evidence is that aspartate 1 also may act directly, that will suppress the male differentiation in the absence of SRY also. The ultimate fate of the gonad depends on the molecular signaling pathway definites. At 6 to 8, the first signs of ovarian differences are reflected with the rapid mitotic multiplication germ cell reaching 6 to 7 billions of oogonia by 16 to 20 eggs. This represents the minimal oogonial content of the gonads, which is the maximum oogonia. From this point in time, germ cells content will irretrievably decrease until the sum of 50 years later, the store oocyte will be finally exhausted. Okay, so from the starting the 6 to 8 there is differences, and then 6 to at the 5th month or 16 to 20 weeks, 6 to 7 millions of oogonias develop. Rapidly they'll decrease in the because of atresia, follicular atresia and all this. They finally after 50 years they will be exhausted. Okay. By mitosis, the primordial germ cells give rise to primary germ cell give rise during week 9 to the oogonia. The oogonia transfer the oocyte as they enter the first mitotic division. Rest in the prophase. The process begins 11 to 12 weeks. Perhaps in response to factor produced by the ovary. Ret ovary, there is some factors that release that will cause some starting of the past mitotic divisions that may act directly on the germ cells and indirectly by the action of the somatic cells. Studies in mice suggest that retinoic acid derived from the mesonephros may act as a functional meiosis inducing factor. So they're telling there's some retinoic acid derived from the mesonephros that act as a meiosis inducing factor in the female germ cell. The progression of the meiosis to the diploid stage is accomplished throughout the rest of the pregnancy completed by the birth. Okay, so arrest of the meiosis at the diploid stage is the past meiotic prophase is probably maintained in innovative substance produced by the granulosa cells. So that has to be maintained by the diploid stage, maintained by the granulosa cells, inhibiting substance produced by the granulosa cells. Single ovum is from the two mitotic division to the oocyte just before the ovulation. The second form is the haploid ovum at the time of sperm penetration. So first mitotic division before the ovulation, second is completed after the sperm penetration, after the fertilization. The excess of genetic material extruded with mono's polar body at each mitotic. So rest 23 chromosome goes to the polar body. Gonadotropin whereas growth factor but not sex steroid. Gonadotropin whereas growth. Remember this, not sex steroid. Gonadotropin growth factors. Induce the rhizomes or meiosis in vitro, but only oocyte enclosed like cumulus granulosa cell. The FSS prepare the oocyte for rhizomes or meiosis process. The gap junctions allows the communication between the cumulus cells at the oocyte. The family of sterol is present in the follicular fluid that secrete the granulosa cells, cumulus cells in response to gonadotropin. They activate the oocyte. That follicular fluid will activate the oocyte mitotic rhizomes and maturations. FSH also activate. Then gap junction between the communication between the gap junction that allow the communication with the cumulus cells and the oocytes. Gonadotropin, where it is what are the factors that will activate the activation of the meiosis? First is gonadotropin, there is growth factor, not sex steroid. Oocyte, the cumulus granulosa cell containing the gap junction in between the cumulus granulosa and the oocytes. Follicular stimulating cells prepare the oocyte for rhizomes and meiosis, and the follicular fluid that is secreted the granulosa cells and the cumulus cell in response to gonadotropin that activate the oocyte meiosis, rhizomes and maturation. Okay, this is the oogonia. This is the first mitosis, oogonium. Oogonium is compared to oogonium. Primary oocyte this is from second trimester. Leptotin stage, zygotin, pachytin, and diplotin stage. The primary oocyte is the first mitotic arrested, then mitotic until ovulations. Then first mitotic is started again. After life, first polar body, secondary oocyte, ovulation occur. Then at the time of fertilization, second mitotic division occur, second polar body release, and the mature oocyte will release. Okay. The massive loss of oocyte during the second half of the pregnancy is the consequence of the several mechanisms. First, beside the follicular growth and atresia. First thing is the beside follicular growth and atresia, substantial number of oocyte regress during meiosis. Okay, those oogonia that fail to develop enveloped by the granulosa cell undergo degeneration. So first thing is the follicular atresia. They are unable to envelop by the granulosa cell. That oogonia will be regress. This process is influenced by the gene that actively replaces germ cell death. In addition, germ cells in the cortical area migrate to the surface of the gonadal, become incorporated into surface epithelium or into the peritoneum. Some germ cells, what happens in the cortical area that migrate to the surface of the gonad, they are migrated to the surface of the gonad and become incorporated into the surface epithelium. Finally, or they may be incorporated or they may be eliminated into the peritoneal cavity. In contrast, once all oocytes enclosed in follicles shortly after birth, Loss of oocyte will be only through the process of follicular growth and the atresia. Once they are having the follicular encase in the follicle shortly after birth, the loss of oocyte only through the process of follicular growth and the atresia. Okay. Chromosomal anomaly can accelerate germ cell loss also. Chromosomal anomaly that activates germ cell. Individual with Turner syndrome, the 45X experience a normal migration of the mitosis of germ cell, but the ovarian don't undergo mitosis. Rapid loss of oocyte leaves a gonad without follicle in early life. It affects a fibrous streak. Rapid loss of oocyte leave the gonad without follicles. Okay. The rate of loss of varies. The 10 to 20% express spontaneous menstruation. Also, the rare pregnancy have been reported. In those cases have been spontaneous menstruation. However, the presence of menstrual function represents in patients honestly may be due to there is some mosaic pattern. Those have a mosaic pattern complement undetected mosaic pattern 46X is lying in addition to 45X. Those cases they have a 20% chance of spontaneous menstruations, and that leads to spontaneous pregnancy. Okay. The stage this is the stage 4 stage of follicle formation. 18 to 20 weeks, a highly skeletal cortex is gradually perforated by vascular channel. The originating in the deeper medullary area. This marks the beginning of the follicles formation at the finger-like vascular projection into the cortex. It takes on the afferent secondary sex cord as the blood vessel into the bed previously solid cortical cell mass into a smaller and smaller segment. Some believe that the coelomic epithelium is the origin of the all over and somatic cells, other favor mesenchymal. The primordial follicle arrest with the purpose of meiosis, diploid stage, and followed by singular spindle cell freeground cells surrounded by spinal membrane. Continue until all over diploid stage. Primary follicle, pre-antral and antral follicles, graphene follicle, the fluid fills phase, and the button third estrogen produce does not occur until late pregnancy follicle development. Okay. Ovarian past fasciole under the cystic follicle bearing size. Then anterior begin develop 4 to 5 weeks, but life median eminence 9 weeks. Ovarian uncapabilities. Those having an uncapability which lack of GNRH, lack of antral follicle existing follicle smaller atom, but progression through meiosis development occur. Obviously not dependent on the gonadotropin. Ovary developed receptor in the second half pregnancy. Okay. There is a neonatal ovary, 2 millions at the time of birth, and then 4 to 5 millions, huge depletion close to FSH and all. Ovulations occur. Okay, this is the primordial prime stroma, as I know. Corpus luteum formations, if the fertilization occur, that will be supported by the progesterone. Not occur, there will be okay.